Hello everyone, today on this lecture we discuss about primary health center. So the primary health center is the basic unit of structural and the functional unit of public health services. Because in sub-center, if the patient is not managed in sub-center, that will be referred to the primary health center. So primary health center is the cornerstone of the rural health service. In rural health service, it is the first stone, that is the stone, or we call the cornerstone of the public rural health service, and it is the first contact between the community people with the medical officer, because the here is the one where the first the people, the villagers or the people of the community, they will meet to a doctor. In substance, there is no medical officer is there, but in primary health center there is a medical officer. So it is the first contact between the community people with the medical officer. So it acts as a referral unit of 6 sub-centers. So under one PHC there are 6 sub-centers are there. So one PHC it's it's comprised of 6 sub-centers are there. So those cases who's not managed by the sub-center, that will be referred to the primary health center. If primary health center is not manage the cases, then they will refer the cases to the CHC, district hospital or medical colleges. So by this way our health process, health delivery system is going on in rural area. The evolution of the PHC. So when the term PHC was started from the pre-independence time, it is suggested by the Bhore, Sir William Joseph Bhore. He coined the term, or he suggests the primary health center, that is about in the year of 1946. So he told that, he suggested that it is a basic unit of integration of primary preventive care and curative health services. So this is a suggestion of PHC by the Bhore Committee in the year of 1946. So after Bhore Committee, Mudaliar Committee also gives some suggestion to how to strengthen this primary health center in the year of 1962. So by this way, this primary health center playing the major role in the rural health services. Let's see the establishment criteria. It is about 30,000 population, one primary health center is there, because as I told that the 6 subjects comprise of consist of within 6 sub-center, 1 PHCs are there. So there is 30,000 population in the plain area for a PHC, 1 PHC, or hilly and tribal area there will be 20,000 population, 1 PHC will be established. So what is the staffing pattern? How many members, how many medical officer or the paramedics are working? There about one medical officer and supported by 14 paramedic workers are there. Just like one medical officer, second the pharmacist is there, then the health worker male, health worker female, staff nurse is there, health assistant male, health assistant female, health educator is one of the posts is there, and the upper division clerk, lower division clerk, then come to the driver, and also class 4 karmachari or class 4 sweeper. There are 4 persons are there. So if you calculate, then it is about 15 staffs are there in a 1 PHC. So what are the objectives of the PHC? That is important to know about the objectives. It is to provide comprehensive primary health care. Okay, so it is provide a comprehensive primary care including curative health services, promotive health services, preventive health services, that also the package of health services that will be available in the PHC. So that is provide comprehensive health services. Next, to achieve and maintain the standard of quality care, that is very important. It is also mentioned in the sub-center also by the Indian Public Health Standard. This has criteria, he's made some criteria to provide a quality care that to be provided in the primary health center. So that is the main objectives of the primary health center. Next, what are the services are available, or you say what are the function, or you say what are the service that will be provided, delivered in the primary health center. Firstly, the medical care. So in the primary health center, there are near about 4 to 6 bed also there. The inpatient services are also be available in the primary health center. So medical care is there. So medical commissioner is there, is medical officer is there. So OPD, outpatient department is there. There is about 4 hours out OPD facility in the morning time and 2 hours in the afternoon time. Second one, 24 hours emergency services, just like accident or dog bite, snake bite or trauma. That case also be managed in the monitor. Emergency services are also provided in the primary health center. Second one, the referral service. Those cases is not managed in the primary health center, that will be referred to the community health center or to the medical district hospital or the medical colleges. Inpatient services, so if there is provision of 4 to 6 bed is there, so inpatient services also be provided in the primary health center. Second one, that the maternal care. So the maternal care is a full combination of antenatal, intranatal and the postnatal services. So the antenatal services, in antenatal services, early registration is very important. That is within 12 weeks of pregnancy, or we say the first trimester, within that period early registration is important. Second one, at least 4 visits should be there of the pregnant mother or the health workers to the mother home visits, by which it can provide the registration and also toxide, tetanus toxide, iron and folic acid tablets and health education will be provided. Second one, internatal, during the time of delivery. So we educate the mother or motivate the people of the community to adopt hospital to institutional delivery, because if you was carrying the delivery at home, so if emergency situation will be arised, very difficult to manage. So we motivate them for the hospital delivery. So in institution, if there is any situation arises, that can be easily handled. So institutional delivery is motivated, or if any cases of hypertensive mother or high risk cases, that will be immediately transferred to the nearest hospital. Third one, there is the postnatal care. So the postnatal care, just after delivery, at least 2 visits must be there within 48 hours. First visit within the 48 hours and another second visit, that is within 7 days. So at least 2 postnatal visits should be provided. That type of help is also provided in the primary health center. Next, child care. So in child care, there is a neonatal resuscitation. That is very important during just after delivery. How to first half an hour, how to manage the children, newborn child. So that is very important. And breastfeeding and immunization and vitamin prophylaxis, that also provided in the child health care services. Next one, that is the family planning, motivating or educating the people to adopt the temporary methods of contraceptives, permanent methods of that are available, and educating about the motivating them for tubectomy, vasectomy. So these are the family planning services also be provided in the primary health center. Next, health education for the prevention of the reported infection or the STI, so sexual transmitted sexual transmitted diseases. So those gonorrhea, syphilis, these are the cases that can be early identified and early management, that will be the problem of the mother will be solved. So this is the health education for prevention of this diseases. Next, disease surveillance and the control epidemics. So constant monitoring the people about the endemic disease. So endemic disease means within population. So some of the disease like dengue, malaria, filaria. So these are the diseases that will be certain people, certain population, it will be alleges. So if you are monitoring the basic sanitation or water quality or the surrounding of that area, surrounding of that particular area, sure, this disease will be solved. So monitoring the water quality can be managed by the hydrogen sulfide strips. If you take these strips and check the water, so that can be the presence of bacteria that can be detected. So by this way we continue surveillance and the control of epidemic will be that type of service that also be provided by the primary health center. Next, training of ASHA, health worker and TBA, that are trained birth attendant. The ASHA, there is a accredited social health activists, so they are working near about 1000 population, so educating them or by monitoring their work or guiding, supervising their work, they are doing the work properly or not. This is very important. And the training of the TBA, trained birth attendants, is very important. They have to how to handle the delivery at home delivery, and how they manage the cases, how they maintain the temperature, maintain the newborn care they will provide. So these are also training should be given to the trained birth attendant. Next one, that the basic laboratory facility services are available. Routine checkup like blood test, urine test, stool test, that also be possible in this primary health service, primary health center. And also the malaria slide, slide for malaria test, that also be available, that can be checked in the on the primary health center, because as there is laboratory facilities are there. Last one, that is the record of vital statistics. So record the number of death or number of birth in that PHC was in one day, every day or in every week, that will be reports to be submitted. So this way we can collect the vital statistics, and record should be properly maintained. So this is the all about the primary health center. So the primary health center is an important topic in the this community health nursing, because primary health is a basic structure, as I told, it is a basic unit of basic structure and the functional unit of public health service, and it is a cornerstone. And this term primary health center was coined from the pre-independence by Joseph Williams Bhore, suggested by Bhore Committee in the year of 1946, and Mudaliar Committee also given some how to focus, how to strengthen this primary health center, how they works in properly in they would deliver quality care, that also be suggested by the Mudaliar Committee. And these are the health services. All the health services is provided, that's why it is called as providing the comprehensive primary health care will be provided. So this is all about the primary health center. Thank you for watching. Please keep on subscribing.